following is a production of West Virginia Public Broadcasting.
Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University. Welcome to Doctors on Call. Tonight's topic, hearing. Two experts are here to answer your questions. Now here's your host, Dr. Kathy Moffitt.
Good evening. Many of us will have some level of hearing loss as we age. That's not uncommon. It could be temporary or permanent, perhaps caused by accumulated noise or injury, or disease. Sorry about that. Some people are born with profound hearing loss, but there are options for treating many types of hearing problems. How is hearing loss diagnosed? What treatment options can help your tinnitus? Can a cochlear implant change your life or your child's? We'll get answers to those questions and more tonight from our two guests, Dr. Stephen Wetmore, an ear, nose, and throat specialist at WVU Healthcare, and Mary Archer, an audiologist at WVU. If you'd like to ask our guests a question, give us a call. Our phone lines are now open. So, Steve, we live in a really noisy world. A lot is going on. How can we prevent hearing loss?
Well, when you're exposed to really loud noise, you should protect your hearing. For example, if you're in a rock concert, you should probably wear hearing protection, like earplugs. And
the kids now, with all these earbuds in?
Yeah, we worry about increased noise-induced hearing loss, but the data so far shows that it really hasn't happened. So they may be safer than we think.
Well, good. And Mary, speaking of our children, we think of earbuds with children. We screen newborns for hearing loss now.
Yes, we do. We've been doing that in the state of West Virginia since 2000.
And how common is it?
Well, hearing loss in the general population of newborns is about 1 to 2 children in 1,000.
So that's a fair number.
Yes, it is.
We have then a fair number born in. So how do you screen a newborn? They can't really tell you what they hear.
No, they don't raise their hand and say they hear it. Right. It is actually done biologically by putting sound in the ear and using electrodes to measure the brainstem's response to sound.
Now, are there children who will have a normal test and then develop hearing loss later on?
Sometimes. Certain things like a child who might get meningitis later on could develop hearing loss. There are some genetic hearing losses that are delayed in onset, and they can be progressive later on. So, yes.
Right. And how common in the general population? So 1 to 2 per 1,000 in newborns. But then what about the general population?
Well, we think that approximately 28% of the population in the U.S. actually has some degree of hearing loss, and perhaps maybe 500,000 or 750,000 actually have profound hearing loss.
And are those mostly elderly who need to wear hearing aids, or is it a variety of reasons for the well, either one?
Well, actually, the largest percent of people are actually elderly, people over the age of 65. About half, a little bit more than half of all the people with severe hearing loss are in the elderly population.
And so we talk about these loud noises. When you mow the lawn, when you use those leaf blowers, I guess, wear protection, is it good to have a good set of either earplugs or earphones or something to protect your ears? What's the best way?
Absolutely. Either type will work fine. Either the plugs or the muffs provide quite a bit of protection. So definitely people should use those devices when they're exposed to loud noise, because otherwise they may get hearing loss.
Mm-hmm. Now, how often should we get our hearing tested? Is there a time other than, well, I guess in kids we test hearing at well child checks?
Yes, most physicians now are doing that in the preschool range in their practices. Obviously, children who are going into kindergarten get a pre-screening before they start kindergarten, and the school systems do periodically test, like some school systems may choose to do the first grade and then the third grade and then the sixth grade. So there are different standards for that. Other than that, I like to test children who periodically who have family history of hearing loss, just to make sure that they're not getting any kind of a progressive hearing loss.
Right.
Now, as far as adults, I kind of leave that up to the primary care provider, but most of the primary care providers, once people reach the age of 45, 50, 55, they start asking them about hearing loss.
Now, I think I've experienced this in my own family. Sometimes the person who has the hearing loss isn't really aware. Is that right? You're laughing,
Yes.
but they're not aware that they don't hear?
That's right. Probably the majority of, I hate to say this, but the majority of men who come in with hearing loss are brought in by their wives who complain that they're not listening and not hearing them. And it turns out that a number of these men actually do have hearing loss.
Right.
Hearing loss is quite prevalent, especially in West Virginia, with a lot of people in the mining industry, and a lot of those individuals do have hearing loss.
Right.
From
So there
noise.
is the selective hearing that we know that occurs, but it's a little more than that.
Yes.
Or maybe having to turn up the television. And the other thing that I've become aware is that sometimes older people may seem to tune out, and you think maybe they have some dementia or Alzheimer's, and it actually might be that they have hearing loss.
That's true. In fact, there have been some studies done that show that older people with hearing loss will often perceive themselves as more handicapped and be more depressed. And if you intervene and fit them with hearing aids, and then you reevaluate them on a handicapped scale, they will perceive themselves as less handicapped and will be less depressed and more interactive.
Wow, interesting. So we have a caller from Pansy in Virginia. Hi, Pansy. What's your question?
Yes. I know I had an accident. I fell out of the truck, missed a step, but I've had a hearing problem in the right ear for a long time. One doctor will say I've got an inner ear problem. Another one say I don't see no wax. I can't hear people talk. I ask them to repeat themselves. I turn the TV up. And I'm supposed to do exercises to make myself dizzy. I have ringing in my ears, and feels like it's plugged up.
And so what's your specific question? Are you wondering what do you want to know about?
I want to know what I can do about it, and what's wrong with my ear with all the symptoms that I told you.
Could I ask just approximately how old are you? Over 50 or older than that?
5.
So she's 55
65.
and 65. Excuse me. Well, I'll make you younger anyway. 65 and is having quite a lot of trouble.
Yeah, I think the first thing I would do is suggest seeing an ear specialist to be evaluated, check the hearing, how bad the hearing is, what type of hearing loss it is. It sounds like she also has dizziness, and that's a separate symptom that should be investigated too. There are a lot of different causes of dizziness, and most of them are treatable.
Right. And so balance and dizziness, how is this related to the ear?
Well, the ear has to do with both hearing and balance, and some diseases will affect both sides or both portions of the ear. Others will just affect either hearing or balance. So it really varies a great deal as to the manifestations of the particular illness.
And tinnitus is actually a ringing of the ear?
That's correct. It is, but it's not in the ear. It's theoretically believed that tinnitus is actually in the cortical area of the brain. And when the inner ear is damaged, and the little nerve endings in the inner ear are no longer sending that signal to the brain then fills in its own noise.
Right.
And that's the theory behind what tinnitus actually is.
Okay, interesting. So we have a very nice story, a success story of a little girl with hearing loss, and we'll hear about her journey in getting a cochlear implant that Dr. Wetmore helped perform the surgery on. And the little girl's name is Tori.
Tori Bartholomew was born deaf. By age 3.5, she had learned sign language, but was unable to speak clearly.
Mama, say mama. Tori, come on, come on. Mama. Okay, good. Okay, look. Say bye-bye. You miss. Bye-bye. Now say it. Come on. Say bye-bye. Okay, good.
Tori was fitted for cochlear implants, small electronic devices that provide a sense of sound to profoundly deaf patients. There are two parts to a cochlear implant, a part that is surgically placed under the skin, and an external portion that sits behind the ear. The implants bypass damaged portions of the ear and directly stimulate the auditory nerve. With intensive post-implant therapy, young children like Tori can acquire speech and language skills. Just listen to Tori 6 months after receiving her implants.
Purple. Okay. Yellow. Yeah. Red. Okay, that's more than random.
Everything's new for me.
Now 13 years old, after cochlear implants and intensive therapy, Tori can hear and speak clearly.
Roger caught the fish.
Roger caught the fish.
John began to paint.
John began to paint.
They were talking about the fun they had.
They were talking about fun they had.
They were talking about the fun they had.
They were talking about fun they had.
That's right. Very good. That is simply a demonstration of some of the auditory things that she can do. I'm going to just ask her a few questions here, and we'll just let you hear a little bit of her conversational speech. Tori, tell me how old you are.
I am 13 years old.
And when was your birthday?
February 1998.
Can you tell me a little bit about playing soccer?
I played soccer when I was in kindergarten. I finished up in 3rd grade.
And why did you stop playing soccer?
Because I want to dance when I get in 4th grade.
These are typical results for a cochlear implant recipient if they've had excellent therapy and good parents and they've been implanted at a very young age.
When she first got her implant, I was just excited because she could hear things. Now she's dancing. She played soccer for several years. She just, the whole overall results is just amazing. She's mainstreamed in a regular middle school.
Last year, I did acrobat ballet, literature ballet, and clogging. This year, I do baton, acrobat, and ballet.
She actually made the honor roll last year at school, and that was doing it on her own with little help from the interpreter because she could actually hear what was going on, see what was going on, and it's amazing.
I like to go to camps for having fun. There's a whole bunch of camps I do, like kids camp, deaf camp.
We joke about having a deaf kid that you have to tell to be quiet because her mouth doesn't shut. It's just constantly, she's talking about things and carrying on conversation. She's using, she got her own cell phone 2 years ago and using it to talk to her friends. I said it 10 years ago and I'll still say it today. The cochlear implant is a miracle. For us, it's a true miracle.
Wow, what a nice story. So I heard
It's
your
a great
voice in there, and I guess you've known her for quite a while too.
Yes, I did perform the surgery.
And so you did it in two different times. When she was 3, I guess she got her first one done?
Yes, and we try to implant the children as early as possible after the age of 1. It's approved by the FDA after 12 months of age.
Right. I know there's a risk of meningitis, and getting those vaccines in is really important.
Yes, it is. It's very important to have the vaccines to prevent meningitis, so we insist that the families have those vaccines.
And why was there such a gap between the first and the second? Is that typical too? You do one and let them heal and adapt?
There are some surgeons who will do both sides at the same time. Most of us will do one side first and then do the other side either months or a year or more later. She just it happened to be a long time before she got her second implant.
Wow, it's really amazing. Must be really very fulfilling to see a little one come and then have him grow up and just like this young lady.
Yes, it's very heartwarming, and that's one of the reasons we're in medicine.
Right. Now you work as a team together.
We do.
And so you do the evaluation of the actual hearing loss?
I do. I do the hearing testing, and if the patient is wearing hearing aids, I evaluate their benefit with the hearing aids. And if I feel that they're a good cochlear implant candidate, I make that recommendation, and then they go on to see Dr. Wetmore, and he does the medical evaluation, and I think you could tell them a little more about that.
Yes, usually the medical evaluation just involves whether they're healthy enough to obtain a cochlear implant. And we do this in children and also in adults. And some of the medical reasons not to have a cochlear implant is if someone is in really poor medical health, they couldn't be subjugated to anesthetic.
Right.
For example, somebody who has bad heart disease and is on blood thinners probably wouldn't want to take the risk.
Right. Our phone lines are open. If you have a question about hearing loss, please give us a call. So about half of the cochlear implants you do are in adults.
Yes.
And those are adults who maybe have had a continued hearing loss from some congenital infection or perhaps acquired hearing loss from accidents?
Yes, probably the majority of the patients have had a progressive hearing loss that they first noticed when they were children, probably on a hereditary or genetic basis, and eventually they lost all their hearing and would no longer get benefit from a hearing aid. However, there are some patients, for example, who had meningitis who have had other illnesses, such as severe otosclerosis, who are candidates for cochlear implants.
So we have a call from Claret in Preston County. Hi, Claret. Go ahead. What's your question?
Yes, I was wondering if there's anything that I could do about being at my left ear. I've got a imbalance back 85, and I'm still after running.
I couldn't quite get the question. I think our phone line is a little bit choppy.
Probably.
Sorry.
About your town, my phone.
No, I think we lost him there. Sorry. He's having balance problems. So we've talked a little bit about how the ear helps to regulate, but what kind of new things do we have for people with balance problems?
Well, actually, our department is just opening a new balance center, and we have evaluation of hearing and of some inner ear evaluations by the audiologist, and they see Dr. Wetmore, and he does the ear, nose, and throat evaluation, and then we have physical therapy involved for those people who can benefit from some type of therapy to improve their balance. So it's very exciting to be able to have this new balance center come into play.
And is this something that is more common in the elderly? The man didn't sound that old on the phone, or is it all ages?
Well, dizziness can occur in all ages, but it tends to be more common in the elderly. And the elderly tend to be afflicted by problems of imbalance resulting in falling and fractured hips and so forth. So it's very important to recognize when people are dizzy and to try to provide some therapy for them.
Right. We have another caller, Susan in Webster County. Hi, Susan. Go ahead.
Hello, thank you for answering my question. I just wanted to know, I've had a problem with long history of mini strokes, and I've been told that I've lost all my high-pitched hearing, and I was wondering if it was related to that.
And approximately how old are you?
56.
Okay, so a bunch of little mini strokes, and she has high-pitched hearing loss. Is that related?
Probably not to a great extent. Normally, strokes don't really tend not to cause hearing loss. I mean, it's possible. I mean, she may have other causes of. She has problems probably with her vascular system, and she may be more prone to hearing loss based on that.
So the blood,
also.
just even blood flow, like you lose blood flow to your heart or your brain, and so you have a stroke. But and is high pitch? What's the first to go? Is it high pitched hearing in loss, or does it vary?
More often, more commonly, especially in the elderly, high-pitched hearing loss will go first. And for people who maybe have had some kind of drug that's toxic to the ear, like a chemotherapy, or there are some antibiotics that can cause problems with hearing, again, the high-pitched hearing is the first that will go.
See, so that's why men don't hear women, because women have a higher pitch in their voice. I don't know.
That's actually true.
Maybe it is true.
Actually true.
Maybe it is true. Yeah. So we have Claret back on the line from Preston County. Hi, Claret. I hope we can hear you this time.
All righty.
Go ahead.
Hello.
What's your question? Go ahead and ask a question.
I was wondering if there's anything that I could do. I've got a ringing in my left ear from inner ear infection I had back in 1985.
Okay.
And I've had a ringing ever since.
Okay. So he's had ringing in his ears for quite a while.
Well, I think the first thing is to have a good hearing test, because what we want to make sure is that the ringing is not due to something more serious. And the main consideration is the hearing, because usually the ringing is a reflection of the hearing loss at those frequencies. We want to make sure the patient or the person doesn't have a unilateral hearing loss, because there are some diseases associated with that.
One side. So it's better, I guess, to have both sides. But if it's, or maybe not better, but it would be a different thought.
It's more serious. We worry a lot more if it's just on one side.
Right. So we have a call from Helen in Cabell County. Hi, Helen. Go ahead. What's your question?
I've had a problem for approximately 2 years and tendonitis, and I do have it in both ears, and they seem to be equal.
Tinnitus in both ears. Okay. And so how could we help her? She's had the tinnitus in both ears, which is the ringing,
That's right. We first would, again, get a hearing test to determine what the level of hearing loss is, if there is any. Sometimes see a noise in the ear without hearing loss. And then there are several strategies to deal with this. The simplest, most common strategy is that most people experience tinnitus or noise when they're in a very quiet environment. So we try to avoid a quiet environment. For example, if a person has difficulty sleeping at night because of the noise in their ears, we suggest running a fan or a humidifier or the radio or TV, just to have some steady state noise.
A little bit of background. Right.
Another modality that's helpful, in people who have hearing loss, often a hearing aid will be helpful. And not everybody, but some people who wear hearing aids, it tends to decrease or eliminate the tinnitus.
So are hearing aids now more acceptable? Or they seem to be, you see ads, they're smaller, or do people have trouble wearing hearing aids?
Well, I think that it always has been a cosmetic issue for many people. And I think statistically, in general, in the U.S. population, statistics show that there are a lot more people with hearing loss who should be wearing hearing aids than are.
But as you said earlier, if someone is going to be more depressed if they can't hear, or maybe it's annoying to the family around them, then it's a reason to be evaluated and wear them.
It's a very good reason, and the sooner that if you have a hearing loss, the sooner that you get hearing aids, the better the prognosis for acceptance of them and better use of them. If you wait until you're 85 years old and you've had a hearing loss since you were 60, your brain is older and it's not going to adjust to a hearing aid as readily as it would have when you were 60.
Mm-hmm. Interesting. Any last comments? We're almost done here. Exciting time, new things.
Well, talking about hearing aids, certainly the new digital technology is helpful. Hearing aids are better than they were 5 or 10 years ago, and more people can use hearing aids
and
now.
As there's more people wearing them, hopefully it'll be cool to wear your hearing aid when
I think it would be cool.
It would be cool
yeah.
when we need them. We've been talking about hearing problems with Dr. Steve Wetmore and audiologist Mary Archer. Thank you both for being with us. If you'd like to get more information, talk to your family doctor or visit our website at wvuhealthcare.com. For Doctors on Call, I'm Dr. Kathy Moffett. Good night and good health.
Doctors on Call will be back live June 2nd. Join us then. Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University.
This has been a production of West Virginia Public Broadcasting.